added to the already meager resources in the region that are not even enough for the local population. These addressed the media ahead of World Population Day commemoration in Adjumani district.
Uganda has one doctor for every 25,000 citizens, while the nurse-to-population ratio is not much better, with one for every 11,000 people, and much of that staff is concentrated in urban areas. The refugee population escalates the situation, with an estimated 1.3 million refugees, mainly from South Sudan and Democratic Republic of Congo. The massive influx of South Sudanese refugees into northern Uganda has strained the country's already overburdened healthcare system, Adjumani district inclusive, with approximately 241,098 refugees. About 40 kilometers from Adjumani town is Mungula Health Center 4, providing maternity care for both refugees and host community. Aniap Emmanuel, the in-charge Mungula Health Center 4, says the 48-bed capacity facility is constrained.
We register between 400 to 600 clients at the different service points. In a month, Mungula registers an average of 3,000 patients. We compare to our catchment of 13,000 nationals and then approximately 7,000 refugees. That means that the resources we have, that was initially meant to cater for the national population, will have to be divided between the national and then the refugee population.
This center has a 10-bed capacity maternity ward, but according to one of the attendants, they are compelled to discharge mothers before the required 48 hours due to limited space.
We receive many mothers in antenatal where there are only 2 midwives serving. All those antenatal mothers, the postnatal mothers, the family planning, handled by 2 people, and yet in a day they can receive over 50 mothers for antenatal alone. Up to now we are using a 9-bed to deliver. It will admit over 140 mothers in a month. And even the labor suite is congested, which is very risky for the midwives. We have 2 beds where you cannot move when the mother is for labor.
According to the chairperson West Nile Development Association, also Koboko LC5 chairman Ngia Hassan Said, the burden of refugees cuts across the entire region that is constrained with meager resources, calling for affirmative action from government.
When they are there, you can't stop them from accessing services like in health, in education. Personally, I was icked with the issue of mortality, maternal mortality rate that was presented there. Now, if you look around, you look at the number of health workers we have vis-a-vis the population sometimes they serve. This is also a point of appalling. So now we are saying as a team from West Nile, there's a need for an affirmative action that should be considered to West Nile in terms of allocating resources. Because resources are normally allocated based on the population. And they normally consider this population which is presented by you, boss.
The call comes at a time when West Nile district of Adjumani is hosting this year's World Population Day activities, which according to development partners are a good gesture by government to address population challenges.
It is also very rare, and I'm very humbled and honored to be representing that organization in a country where World Population Day is commemorated at the highest political level. We're renewing a promise from 1994 when the world community, and I say the world community, which means all governments at Cairo in Egypt, came together during the International Conference on Population and Development and made a decision and a commitment that people should be at the center of development, that women's rights should be at the center of development.
Under the theme, renewing the promise, empowering Uganda's youth to drive socio-economic transformation, this year's World Population Day commemoration focuses on empowering the youth as an engine for Uganda's realization of the Vision 2040 of becoming an upper middle-income country by 2040, as well as harnessing of the demographic dividend. Bernard Yiga, UBC TV, West Nile.
Now the family